So, very glad to see that. Very glad to see that the overwhelming majority of yesterday's attendees have made it back for this for the closeout of this meeting. It's been interesting as one of the planners to see how these sessions just pile on each other, and in each session we're sort of anticipating the next one, and that's certainly true of the discussion we're going to have this morning about moving from treatment heterogeneity to down to the level of the individual, and whether it's possible to predict individual treatment response and whether that's useful. I'm going to turn it over to Ralph in just a minute, my illustrious co-chair, and he's going to moderate this panel. One housekeeping note, we've been told that there is a meeting, National Academies of Science meeting, just through the thin wall behind me. So to keep the boisterous, we should keep the boisterous applause to a minimum unless you feel honorary this morning, and then you can be raucous and let them know we're having a good time. After this session on prediction of individual treatment effects, we will have a moderated panel moderated by Michael, and I think in there, I hope that we can begin a bit to talk about, to keep in mind the title of this, even though we may have misnamed this meeting slightly and composed the crowd in a way that doesn't fit with the title of In a Learning Health System. Begin to talk about how we could take some of these methodologic issues and some of these challenges to the level of supporting health systems as they begin to use their data more effectively to guide decision making. So that's the panel after this. But now, without further ado, I'll turn it over to Ralph, and Ralph will introduce the speakers for this morning and moderate this session.